Hi, everyone, and welcome to NanoPass's webinar, Advanced Methodologies in Intradermal Delivery. We'll wait for a few more people to join, and then we'll start. So hi, everyone. Again, my name is Adi Jacobson. I lead marketing for NanoPass. We're happy to have you here today with our renowned speaker, Andrew Hansford, that's going to teach us in a few moments about advanced methods for intradermal delivery. I'm happy to also introduce our CEO, Daniel Levitas, and Dr. Efrat Kochba, our VP of Medical Affairs. Efrat, would you like to say a few words before we start?
Hi, everybody. Welcome to this webinar. Thank you for joining us. I know that you have different times all over the world, but I hope you'll enjoy this one. Adi will give you a few words about how we're going to handle this webinar, and then I'll introduce Andrew.
Wonderful. Andrew, if you can please share the presentation. Wonderful. So a bit about how to interact in this webinar. You have the QA function on the bottom bar in this webinar. Please post any questions you'd like to ask during the webinar. There we'll have a few pauses for questions and then we'll answer them. We'll also answer them in writing. Please use the chat function if you'd like to post any technical questions, or if you'd like one of our team members to follow up with you with more information, just write your email and we'll be happy to get back to you as soon as possible. Towards the end of the webinar, we'll be happy to give time with Andrew for live questions. So please raise your hand in the hand function in the bar. In the middle, if you'd like to for us to refer to you live towards the end. So Andrew, take it away. Thank you.
Thank you so much.
So let me just introduce our speaker. Andrew Hansford has been doing this clinical education for over 25 years in the UK, and we're happy to have him with him. He's founded the ACH Aesthetics dedicated for training academy in London with many success stories and a lot of experience with our device. So thank you, Andrew, and please go ahead.
Thank you to you both. First, it's an absolute privilege to be part of NanoPass team and to bring this revolutionary device to tonight's webinar. And as we said, we can do some Q&As as we go through, and at the end, if you have any questions. So first and foremost, from my perspective, this was actually a game changer, and I never use that terminology, because I think a lot of people do. And in the wrong way. This absolutely was. And just a very brief synopsis. For over 20 years, I have been teaching, especially things like mesotherapy, which I'm obsessed with. And it was always done with a single 30 gauge yellow needle, which is always nerve-wracking, one from a patient perspective who may be nervous of needles, but also the practitioner injecting it. And obviously the most important area of concern would be ocular. And as you're going towards the eye with a needle like that, you're pretty much going to bruise them on numerous occasions. So that was always a slight problem. So I always knew the treatment was amazing, but there was always this caveat of the possibility of bruising or any issues and anesthesia and all those sorts of things. So when I first came across this particular device, and I'm not proud to say, I actually had tears in my eyes, because not only did it allow me to participate in the practice of it myself on my own particular clients on a far safer way, but also teaching. So overnight, my teaching practice changed. I was able to be able to deliver this technique and device to practitioners all over the world, teaching them to inject in places they would historically have found quite difficult or would have been a little bit wary of. So as I said, it really was. That's why I'm here tonight, because I really do believe that it is a game changer within the industry and a device that everyone should use. So from a technological perspective, it's been around for a while, and we have the ability to deliver a virtual painless delivery system without any fear coming from the client and also the practitioner in some respects. It has an FDA clearance, which is obviously unheard of with a needle of sorts, because even though it's very small, they are still hypodermic needles. And having an FDA clearance always makes that an extremely important idea, followed with ISO number, etc. We also know, as I started to get involved more with the device, its history, and knowing that it's been used on over 30,000 injections on 7,500 patients, and unbelievably over 60 completed and ongoing clinical trials, which is, as I'm sure we're all aware, is relatively unheard of. And we have this historical pathway, which is so important in any medical application, that we have that history. So that history is the ability to inject or use with vaccines, immunotherapy, including cancer, diabetes, and allergies, and systemic delivery of insulin. So it has been used historically all the way through for a long period of time prior to it entering into the world of aesthetics. So the technology is, as I said already, a game-changing device. It is precise. And that's the bit that's so important, especially as, again, you are absolutely aware that the injection depth is paramount to where you're placing it. So with me teaching mesotherapy for so many years, I know that the perfect placement for that product is between the 0.5 and 0.6 to touch and break through the epidermal junction. And this gives you that 0.6. It could be mounted on any syringe, whether it's Lurlock or normal, and you have that complete control over how much is being delivered, and also the safety, knowing that you cannot go any deeper than that. So it means the actual treatment time is so incredibly quick. By doing it with a single needle, you do have to be, so if you've got your yellow 30 gauge needle, and you're trying to get 0.6, how incredibly difficult is that going to be to do that every single injection point? Almost impossible. This you absolutely can. It's also made of silicon crystal, which we'll get to in a second. Created through a process called MEMS technology, basically meaning very small devices. Components on a single microchip is one. But despite the size, the amount that they can do is mind-blowing. It's used in many, many, many things throughout the world in very different industries as well. And you can see by those images how tiny they are in relationship to their power and their ability at what they're doing. I mean, the world is going nano now, isn't it? Everything has the word nano in front of it. But MEMS technology has been around for a while and proven and incredible. How it works is being less than 1 million size and having that fixed penetration depth, which I've already touched on, is the most important thing. So we have that precision. And as you can see by that bottom left image, we are implanting, placing, and allowing that product to slowly migrate into the lower tissue. With dermal application, especially with things like mesotherapy or boosters, sometimes boosters and mesotherapy definitely do not need dermal. They need the growth factors that are responsible for the regeneration, which is epidermal growth factor and the keratinocyte growth factor, both of which sit in the epidermis. So both of those need to be targeted. Then if we need to go deeper, the product will slowly migrate. You will see a papule almost immediately, as you can see it visually. You place it because of the size of the actual device. It's extremely easy to place wherever you may want it to go. You can also, I call it tracing or trace removal, meaning you have the 3 needles, which in some cases you will actually inject the 3 needles in a horizontal way with the needles, 3 of them facing you. But you can also turn it on its side and chase away lines. Because you've got to remember also that 0.6 is a really good controlled depth for healing. So you're creating a micro wound at the same time as implanting product. So you're doing the best of both worlds. So for fine lines and wrinkles around the ocular or the perioral, I would chase the line with the device. So you create that wound and you implant. You get both. As we've already said, the difference is quite shocking in a way. You've got 1.5 needle with a static needle, and standard needle is 13 mil. The precision for MicronJet is extremely high because every single time it's the same. With a standard needle, it's pretty low because, again, like I said, it's the injection depth, how far we're going, how much product am I placing in. You don't even really need to look at units, actually, because you can see by the size of the papule that comes up right in front of you. So you can make them identical every single time. The pain level is minimal, extremely minimal. The only place it will ever feel a little bit would be directly in the corner of the eye, and maybe a couple outside of that. But I've never had anyone say the pain level was higher than a 2 or 3 in comparison to what it would be. Pure pure silicon technology, which is also quite incredible. It will never blunt, or it eventually, but you're talking about many injections. So, for example, with toxin, most practitioners will hopefully change the needle every 4 to 5 injections because the needle will blunt. With this, it absolutely won't. So with the fact you've got the no blunting, it means that you can do multi areas at the same time without actually having to change the needle. We have 2 variances on this one. The first one that we have at the moment is the MicronJet 600. So it's 0.6 and with a 31 gauge. This can be more used for most fluid products. So relationship to mesotherapy, toxin can be done with this, like hyperhidrosis, etc. You can get some slightly thicker fluids through it. It's just a little bit tougher to get through, but I've absolutely done it myself. Then we have the coming soon, which is actually very exciting, which is a 0.8. This is where you can start to work with skin boosters and things like a superficial filler, which won't give you Tinder or Tyndall effect. You can, and again, you are chasing away the lines from a superficial perspective. And I've done that quite a lot because, again, as I'm sure you're aware, around the mouth and lower jaw area, it's quite difficult to do that with filler. It could be a little bit ducky looking, overfilled, because you're not actually targeting the line specifically. You're tending to fill, unless you're doing like linear through the lip, which can be quite difficult. But in this instance, again, no need for anesthesia. Very small papules directed along each of one of those lines around the perioral and periocular as well. And then that filler, that superficial, will just bleed out into each other and help to remove that line. Honestly, that one is incredible. As I mentioned earlier, we have everything. All the regulatory processes that are needed is all cleared, which is extremely wonderful because, as we know, as clinicians, our first port of call is safety. So we know we have the entire safety profile done for us. Thank you very much. Meaning that we can move on with doing the treatments with confidence. We have lots of clinical evidence in relationship to the actual procedure itself. So we know that the penetration depth is safe. We know that it is very reliable. We know that it's leveraged in many vaccines administered historically. We know that it's used in multiple territories and many, many different injectable products that can be used. For example, influenza, COVID, Boster, polio, insulin, mesotherapy. We have all the links to publications that you will absolutely, we're more than happy for you to read. It's really, really interesting, actually. And with all those clinical studies, I mean, it's incredible that we have this much information dedicated to a single needle or device, sorry, 3 needles, but a single device, which is really, really powerful. With the intradermal vaccination benefits, dose sparing. So most of our vaccines are used at 40 to 40% of the dose intradermally. So this includes flu, rabies, polio, COVID, mRNA, and Boster, etc. We again know that we can actually implant perfect depth amounts each and every time, and in the right place, safely, efficiently, and quicker. Which, when you're in a clinic doing vaccination on a regular basis, we all remember COVID, those queues around the block to get the vaccination. This was absolutely a game changer when it comes to that, because you can get this done extremely quickly without taking away from any of the efficacy of the actual injection. It can improve immune response too, which is demonstrated in flu vaccines and hepatitis B. So we know that we've got more of the studies related to that, showing that the immune system response is going to be so much stronger and more supported by using a device like this. Side effects, almost none. Because again, we're targeting it. You've got the compliance is there. You've got better patient satisfaction, but because there's no pain for them. And a reduced cost, which is obviously good for everybody actually using it. We have usability of performance data as well in relationship to the training and the learning curve surrounding it. So we do have, I do in the United Kingdom, do face-to-face training. In some countries, they will absolutely do that too, but it can be done online as well. It's not a particularly difficult thing to learn. I will go through that in a second. So we have studies that confirm the intradermal injection there. We have animal models, study locations from partners from all over the world. We have ethical approvals. We have adverse reactions. There's been no severe dermal reaction observed. We have mild reactions, so minimal bleeding, slight erythema or erythema, but it's so short-lived. The duration of observation post-injection could be up to 9 hours, yes, but that would technically depend on the product you're using as well. You've got repeat experiments, injection volumes, bleb formation. For example, 98% of injections will actually form a bleb. The MicronJet 600, we have no leakage observed in 30 devices, and additional studies in vivo, guinea pigs, and various animals. It's a study too, again, that you're more than welcome to have a look at, which is a needle-based device from Vitalizing Solutions of free hyaluronic acid. So that will be pretty more on the mesotherapy side of the thing. But absolutely read this, it's very, very interesting. Preferential preference data. So we know the studies for future vaccines, 72% prefer the MicronJet. When it comes to the children, well, obviously that's really good too. Children could be very nervous. And as also we know that we've all seen patients who come to clinic who are extremely nervous of needles. Where did that come from? It's a psychological thing. I think a lot of the time, no one's quite sure why they're so scared of needles. Could that be childhood trauma? Quite easily. So we're removing that childhood trauma. They look at this needle, they can't even see it. The pain. So we've got 75.55% painless and intimidation, 63%, so technically not intimidating at all. As you can see by this is exactly what I mentioned earlier about the amount of injections that you're doing. So for the toxin especially, before treatment, after 6 injections, you can see what the needle looks like after it. And as you can see, the top, the Micron 800, after 50 injections, hasn't changed at all. The clinical evidence sits strong, as we've said. So we've got lots and lots of clinical evidence, again, related to the safety, the dose sparing, the improved immunogenicity, the improved durability, the non-side effects, its ability to go into muscular subcutaneous vaccinations. We've got all of this, plus to reiterate 30,000 injections. I've done over 7,500 patients. That's incredible. And again, I have to reiterate this because it's so important. Over 70 completed and ongoing clinical trials. I don't know a single device in my history that has that much going on. And also we've got the different studies from different parts of the world, which is so extremely important because we're all beautiful human beings from different parts of the world, from North America, Europe, Israel, Hong Kong, Brazil, all over, working to support this going forward. Does anybody have any questions so far? Oh, okay. So hopefully that means I've done my job properly so far. Don't worry if you have, we can always answer them later. So user cases, this I'm quite happily to say, most, if not all of these, are done by either myself or people that I have trained historically. So I know where they come from. Using it, for example, one technology suitable for multiple aesthetic applications, cost and time saving, safer due to the miniature delivery pyramid, comfortable and practically painless, precise and ideal for delicate treatment areas. So easy to learn, virtually pain-free, accurate dermal penetration each and every single time, and the slow release, which we mentioned earlier. These are two of mine. So the top one is obviously hair loss, and the second one is pigmentation around the eye. That was actually only one treatment, I have to say. And if I'd have done that with a single needle, I would have been quite nervous because I would have had to have tried to get right in here, in this area here. And that's nerve-wracking. With this, I had no fear whatsoever. So dealing with absolutely hyperhidrosis, perfect. Migraines, mesotherapy, hair restoration and management, and target work like pigmentation and ocular concerns. So I know if I've got a patient or client on my bed, on the couch, I know that, oh, they've got melasma, they've got a small piece of pigmentation, they've got areas that I want to focus on. So I could use a particular product that's relatable to that particular condition, and then use that MicronJet just to implant in those areas as a standalone. I never just do that. I do everything else as well, but that's what you absolutely can do. Here is what you would look at for the skin boosters. So as I mentioned earlier, about around the ocular and the mouth, there's very fine lines you can see. You literally draw them away by placing the needle more vertically as you're working up the line, each and every one of them, just depositing a small amount of very superficial filler. It almost looks like it's been stitched, little bumps with a little tiny gap in between. And then after about an hour or two, it just starts just gently bleed, and they all blend in to help literally restore that area again. The 800 is absolutely perfect for skin boosters. So I'm of the opinion that skin boosters should not be put in deep dermal. I've never seen particularly good evidence related to it being that deep. I think deep dermal should be basically kept for projection when it comes to filler, but we want reticular. So we're looking at around 1 mil is 0.8 is perfect to break through that epidermal junction, to implant the product, and very slowly migrate through the topical dermis. Because obviously what we're looking for here is HA is there to kickstart our natural hyaluronic acid, because we know that it disperses after a period of time. We want our natural HA to be converted. So having it there slowly migrated gives the skin its best optimal amount of time and chance for that to happen. Again, these are all, I happy to say, one treatment. So you can see with this lady here, chased the lines, each one individually, right along. That's after one. This gentleman here, the same thing. This is obviously a little bit more work. But what you can also see here, and this is more treatment protocol related, as well as implantation using the device, but look at the pigment. The pigment has also reduced quite dramatically, and his lines are reduced quite a lot. This was amazing. This is someone I trained, and that result is incredible. But she was right in here, injecting right through this here, ignoring the prolapse fat pad and going up through in here. This was a lady, a nurse friend of mine, who was concerned of her perioral lines and doesn't like needles. Bizarre, I know. So I did that. This is about an hour later. Went in between each one of those lines with superficial filler, and that's the response. Even through here, we can see hands, incredible. Post-COVID, hands have become a really big thing. It should always be, but it seems to become a little bit more fashionable, should I say now. But hands are amazing because, again, hands have always been, well, by a lot of practitioners, it has been implanted with cannula, or those other options, lasers and things like that. And, there's nothing wrong with any of those things. But in this instance, no pain. So this is quite a, I think 35 milligrams of HA, I believe. And I did get this through the 0.6 and very slow, put them all through. This will bleed at least an inch circumference around the whole thing. And obviously it's going to give that incredible hydration to the hands. This is me actually doing it, so you can see how close you can get to the eye and also how incredibly quick it is. It just gives you such safety and ease of application. This is more target work. So the right-hand side, I'm targeting the marionettes area and nasolabial fold. The left hand, we're just pretty much going everywhere, just giving a complete rehydration to the whole skin. Right hand side is exactly the same. So as you can see by the right hand side image, I'm just literally stretching the skin, applying the product, move on. If I was doing that with a single needle, one, slightly uncomfortable, two, I'd have to spend a lot more time working out the depth and making sure I'm getting it right every single time. But in this instance, I mean, that whole face was done in literally 3 minutes. Head, same thing. So you're looking at hair restoration and maintenance. And this one's impressive. So you can, I mentioned earlier about how close you can get in the corner of the eye. So if you've got clients with more of a skin patch before and above, you do tend to get that sometimes pigmentation in that very corner. And it's really quite tough to get that. And look, I injected that directly into that corner. And then obviously followed suit surrounding the eye, just above the ocular bone, and then just above that as well. And the client is literally quite happy in pure comfort. This is, I call this chasing. So this is lines that I'm trying to chase away, trying to remove. So décolleté, obviously a lot of people get that deep line in the central in the chest area, surrounding the neck, Nefertiti lines, all of those things. we can literally just chase it away. And as you could possibly see by this, the needles are horizontal facing me. So I'm going in horizontally in each one of them. And again, removal of lines. Just tapping it in. The center one is overall hydration, skin health, optimum skin health. The lady on the left and the right is the same person. And you can see that I'm just focusing on every line I can see and just using the device to remove those or as much as I can. And we showed the image earlier. This is nice and easy to implant.
When you first go in at 90, go to the 90, stretch.
Now let's just pick up on one thing before we go back to the images. What some people can have a tiny problem with is the use of the needle when they first get it in their hands. The reason being is because, especially from the medical standpoint, most treatments there's more force behind them. I don't want to use the word aggressive, but it's a bit like that. You push that needle in. You're going deep, whether you're doing, think of the B5 injections, whatever it may be, filler, Botox, needle goes straight in without any technical fear specifically. When it comes to the NanoPass, it is the complete antithesis. It is very superficial. It's very gentle. That almost takes a little tiny bit of time to just get your head around. And the three things are very, very simple. And what I do, even now, if I haven't used it for a couple of weeks, I just go back to the drawing board and I go, okay, stretch, dry, angle. That's where my head goes. So when you think stretch, I don't just mean a small stretch. I mean really stretch. Even if you have to manipulate that person's face, you want it to be as tight as a drum. Because you can imagine if you're sorry, excuse me. If the skin is buckling, the needle's being pushed against tissue, and then you're going to get backflow coming out. And it also is very difficult. I'm being honest here. 95% of anybody who's contacted me after purchase or are trying to use it and saying they're having problems is because they aren't stretching it. So I always say stretch, then stretch again. There's not enough stretch you can have. So tight as a drum, you shouldn't see the needle buckle in the skin. The blue line needs to face you, and that's the angle of the pyramid design. And as you go in, almost like a 90-degree angle, you just lift up ever so slightly, almost like a fish hook, just ever so slightly, and then with zero pressure on the needle. The pressure comes from the plunger. There's more pressure on the plunger than there is on the needle. It's a little bit like that thing we used to do as kids where you're rubbing your tummy and tapping your head at the same time. It's a little bit like that. Some people take 2 or 3 goes before you get it, and then once you've nailed it, it is the easiest thing in the world. And I always say it's more of a trick than a talent. And as I said, once you get it, it's very, very, very simple. But it's just very different from anything we've ever used. That's where sometimes people have a little bit of a hard time. I've also heard leakage. Sometimes it leaks too much. It can, and from my experience, the only time that really happens is because you have to put quite a lot of pressure on the plunger, as you've injected, that pressure tends to be still on the device as you take it out of the skin, and then product stays or purges. So I just inject, release, take the needle out, and then you tend to not get any wastage. So that's it so far. I hope that was okay. Let's have a look to see if we have any questions.
So we have quite a few questions about how to make sure that there is no leakage and to maximize clinical results. You mentioned that inject, release plunger, but can you also refer to the type of product when it comes to leakage? Are there differences?
Yeah, absolutely. But there are with regular needles too. So if you're using them as a therapy cocktail, it's very watery. So that means you need to be a little tiny bit more careful as you're placing the device, implant the product, stop injecting, and then release. You will get occasionally tiny bits of leakage. I don't have any problem with that. I'll just rub it straight back in the skin. The only time I ever find that is areas where the skin is maybe slightly thinner. It's actually quite amazing anatomically, because as you're going around the face, the forehead is tougher because we're close to bone. The eye, easy, really, really easy. Just towards the sides of the face, maybe around we find lines and wrinkles around the eyes, a little bit tougher. The décolleté neck, really easy. It's already related to the injection points within the anatomy of the face and neck. However, if you're using a more of a hyaluronic acid based product that may be slightly thicker, there's almost no leaking at all. I hope that answers the question.
Yes, thank you. We have a question. Is there a risk of VO with the 800, with the MicronJet 800, using skin boosters such as Profilio?
Absolutely not. No, it's too shallow for that. I can't imagine for a second that it would ever do. And also, if you're doing Profilo, the actual Profilo injection is a lot deeper than that. I would never inject Profilo that superficially because the molecular weight of the HA is way too high to be put that high. To me, skin boosters are HA only. I'm not a massive lover because I think there's more to life than just HA. So if you're using a hyaluronic acid with, say, vitamins, minerals, amino acids, things that have a respiratory effect, which HA doesn't, then you can absolutely use the 800 in a more superficial. 0.1 is, in my humble opinion, the perfect depth for anything regenerative. So no, there's no possibility with the VO.
Okay, another question that we have is, do you use the MicronJet 600 or the 800 for hands? What is best?
600 I use for hands. Because obviously you're also looking at the device is amazing because it's your tool for implantation. So if I'm looking at someone's hand and they've got dehydration, yet they're also pigmented, so sun damaged, environmentally damaged, I want to use a product that is relevant for that. So if it's pigmented, I want to hit junction only because pigment doesn't exist that deep. So I would target the more epidermal part or epidermal junction part, which will absolutely be 0.6. If I wanted more hydration, I would use a 0.8 and use them both at the same time.
We have a question about pain. What do you feel the pain scale is when using MicronJet on different patients?
Okay, I'm going to be a little bit funny here. The only time I've ever had anyone say it was uncomfortable would be men who are find pain with everything. Sorry, but it's true. With the average patient, it's never gone above 3. And I'm happy with that.
I think anyone would be happy with that.
Yeah, exactly.
Instead of sitting outside with topical anesthesia for 30 minutes.
Oh, God. The worst. Absolutely the worst.
The worst. Is MicronJet suitable for collagen injections?
Collagen injection? Don't quite know what you mean by that. You mean like bovine injections or do you mean like filler? Because collagen filler hasn't been around in a long time, so I don't know quite what product you're using. But again, all it is just think of the actual product and where it needs to sit in the skin, where it needs to be placed, and can the MicronJet take it there? I can absolutely tell you that with the collagen injections, if you're talking about the ones I think you are, that was like a very long time ago. But yes, they will absolutely get it in.
Amazing. We have a question about where is MicronJet manufactured?
The beautiful country of Israel that I want to come to.
Amazing. It's summer now. It's the best time of year.
I know.
Can you use MicronJet to add volume to lips?
Oh my God, yeah. It's actually really fun in lips. You could use for hydration, first and foremost, yes. So I use like a 35 milligram HA in the lip, the pink part of the lip. Again, in comparison to a single needle, almost no pain. So that's great for hydration. If you wanted to do something a bit more voluminous or a little bit more targeted, you could use a superficial filler. So you could use it. I haven't done this one personally, but I know some friends of mine who have, because I'm not a very, I actually don't like vermilion border with filler. It tends to look a little bit weird. But with the 0.8, they've been kind of chasing around the vermilion border and above into the philtrum, and it looks so incredibly natural. It doesn't have that trout or that duck looking affair, which sometimes can happen. It's so superficial and so natural looking. Yeah, you can put it anywhere. That's the thing. That's the genius of this device.
Can you please elaborate? We have Rotem asking, can you please elaborate on the use with botulinum toxin?
With botulinum toxin, you're basically doing exactly the same thing that you would do when you're administering it yourself, especially for things like hyperhidrosis. It can be, as we all know, that hyperhidrosis can be a little bit uncomfortable when you're using a single needle, but this is pretty much the exact depth where the toxin needs to be administered. It's a lot less faffing about. It's probably the best analogy I can give you. It's so much quicker. But the injections are identical. All you're doing is swapping single needle out for NanoPass.
We have Myron asking, what is the ideal viscosity to be used with MicronJet?
I mean, you wouldn't get a filler through 0.6, you would through 0.8. So like a medium booster, something that's not extremely thick. Like I said, I've got 35 milligrams HA booster is quite thick. I've got that through. It's a bit tougher on the old finger to push that through, but you absolutely can.
We have a question about labs. How long do they usually last post-treatment?
Again, that's down to the product. If you're using mesotherapy, 20 minutes to a couple of hours, depending on the client. But you think you want those blebs. I want those blebs to sit there for as long as humanly possible for them to slowly migrate. Ocular, they're gone within a matter of 10, 15 minutes. Again, but it depends on the product you're using. If it's mesotherapy, dedicated mesotherapy products, it'll go down very quickly. If you're using a slightly thicker HA, maybe neck décolleté, you can have them there for 24 hours. But that's pretty much the same with any injectable of that, those types. But I want that. I actually own it. I say, look, I'm not going under this wrinkle where there's not an awful lot I can do about that because it's way below the actual problem or concern. I'm going into it, right into it, targeting it. So you're going to have these tiny little papules, looks like a bit like a pearl necklace, for up to 24 hours. And I want you to have that. It is the best possible option. But with the average, with the 0.8, almost nothing because you're going below that is deep enough to not have the blebs as obvious. The 0.6 a little bit more obvious, but if you're using meso, it'll go down quite quickly.
We have another follow-up question from Monica about lips. Do you use the MicronJet 600 or the 800 for lips hydration?
Both.
Both.
The hydration, I want true hydration, and that I really would like to be epidermal junction and below. So the lips are quite fine in texture in comparison to some other parts of the skin. So 0.6 is fine, but the 0.8 I would use for if you really wanted if you wanted an aesthetic appearance, you could use a booster in the lips, which will give volume for a relatively short period of time, but it will give you hydration, or for the superficial filler.
I think we've covered all questions. Let me just double check. Yes, I think we're good to go. Does anyone would like to raise their hand to ask a question live? We'll be happy to take it. Oh, we have one more question I see. How long is the learning curve in order to start adopting MicronJet? As it is a different technique from a standard needle. I know that you referred to it earlier, but when you train other physicians, what is the average? What do you see?
It just takes a little, doesn't take particularly long, to be honest. All I say to them at the beginning is just forget everything you've ever done. Because it's antithesis. And I also say to a lot of doctors, I'm like, right, I want you to be nice doctor now. I want you to be gentle. All of the things that isn't part of the remit. You're doing superficial, you're being very gentle, not too much pressure. And Dr. Efrat and myself were talking earlier. If sometimes people have a little tiny bit of trouble, I always say, take it home, fill the syringe up with saline, cross your legs and do your thigh. Because actually this kind of slight hook technique, you can absolutely do in your thigh and you can see it right in front of you. But like I said, the three things, and I do it in my head, blue line, stretch, I'm talking that. A lot of people do this. That's not a stretch. I want that. Keep the area dry, and then just that slight hook. And just if you lift the tissue up ever so slightly, a little bit like if you're doing filler or you're pushing the needle in and you lift it up so you can see the needle and you do that lifting thing. It's a bit like that. But as long as you follow those three things, so extremely tight, blue line facing you, and then that slight hook, you'll pretty much be okay. It might take you 2 or 3 goes and then you'll get it.
Wonderful. Another question is, if you had to pick one single procedure to do with MicronJet, what would be that procedure? What kind of product and where in the facial neck décolleté area?
How could I say that? It's good for everyone. Like asking if I had children, which I don't, it's like asking what's your favorite child? I personally use the 0.6 more than any of the other, only because I specialize in mesotherapy. So, and I know the ocular perfect depth, I know that every area is perfect depth. And then I would pick up the 0.8 if I wanted to go into, and around these areas, because I know I want to go a tiny bit deeper. But it's all related to the product of choice, and where it needs to be in the anatomy of the face. That's really, it's as simple as that.
Ifat, is there anything that you would like to add or to ask Andrew today?
Well, what Andrew was emphasizing, be patient, because there is a learning curve, but once you know how to do it, you just love it. You just understand the benefits. Patients love it. Patients come back, and Andrew can support this. Patient come back and ask for the mini needle, which is amazing and it's not intimidating. You show them the needle before they start the treatment, and then it's so much easier to proceed because it's not intimidating. It's so tiny. So that was, yeah. Thank you for
absolutely
that,
right.
Andrew.
I've had clients who've been like I've done for years, and they're like, "Don't come anywhere near with me with the needle. I will kick you. I do not want anything about it." And then I show them, they're like, they go like that. Where is it then? I'm like, fine, lay down. And then they suddenly get the treatment I've been trying to give them for years, but they would never do before. So we are, that's the thing about this device that's so great. NanoPass have done all the work for us with the studies, the trials, the FDA, all of that's there. So we know the safety, but also it gives us this unbelievable ability to treat without the worry, without the pain, without the drama, without the anesthesia, and get the perfect application every single time. I mean, to me, I never say this, it's a game changer, and it's part of my life now. It will never go away. I haven't used a yellow needle in about 18 months.
Incredible. We have a question about, do you know anything about using MicronJet with cell boosters?
Cell boosters, I assume you mean like polynucleotides, exosomes, those sorts of things. Yes, but if you're using like polynucleotides, exosomes, and 0.8, it needs to be slightly deeper in that, and we need to make sure it's dermal.
Understood. We have Patrick who would like to ask a live question. Patrick, please go ahead.
Hi, Andrew.
Hello,
Hi, Adi.
Patrick.
So I think you've actually already covered it. I was just going to ask, dealing with so many practitioners is about learning the technique. It was just, what do you recommend? And you really covered it with the thigh suggestion. So thank you for that.
That's okay. My pleasure. I mean, I don't remember that. Okay, I'm going to be really honest, right? When I first got the needle, it was delivered by another company, and they just sent it to me. So I saw it in Paris, and I got all teary, and it was all very emotional. But I just saw the video, and I was like beside myself. And then I took it. I got sent with 0 instruction, 0. So can you imagine? There was me and a doctor who I absolutely love, and the two of us were trying to do this on this poor patient, and it wasn't working. We were like, "Oh my God, I can't believe it!" After all that, it wasn't working. So I called France and said, like, "Someone please explain." And they hadn't mentioned the blue line. They hadn't mentioned any of this. All right. So we've gone through like half an hour of this, and then suddenly we did it correctly, and both of us went, "Oh my God, nailed it." We were like, oh, like it was amazing. So there is that learning curve. Yes, there is, but it's not a difficult one. It really isn't. It's just slightly stepping sideways of all the things you've done historically with a normal needle, because obviously it's pushing. We're pushing that needle in. It's something we've done forever. Now we're not, just being very gentle.
Thank you.
My pleasure.
Pat, would you like to conclude? We're running out of time.
Yes, the same thing happened to me when I started working for NanoPass 12 years ago. I was given the device and I was told, go home and try it. And then I figured that the best place would be the thigh, because you can stretch the skin with one hand and do the injection with the other hand. And then, as you said, once I got it, I thought, wow, this is amazing. I've never seen something like that, especially if you think about a regular needle doing this. It's a nightmare.
Yeah. Yeah.
So thank you, Andrew, for this excellent webinar. It's been amazing. And thank you, everybody, for joining us for this webinar and those very good questions. I hope you learned a lot. We are always here for you to answer more questions. You have our emails. I'm sure that Andrew will be happy to answer questions. So I hope you'll be happy with your journey with a MicronJet, because I'm sure that once you get it, you're going to love it.
100%. 100%.
So thank you both. Thank you everyone for joining us today. It's been a pleasure. Please, as Ifat mentioned, feel free to reach out to us at nanopass.com or on our LinkedIn page, or drop us a line at info@nanopass.com. Have a wonderful day and keep those face beautiful. See you soon.
Thank
Thank
you.
you.
Okay.
Bye-bye.
Bye.